Board community subgroup, and we're here to have a discussion on various issues, and you are all very welcome. We have apologies. We have apologies from Councillor Rebecca Lanning, and for lateness, Councillor Una Moulton. I think those are the apologies. It's at this stage where, as chair, I have to ask if there are any pecuniary interests to be declared, and so are there any? I do not think so. Thank you all very much. And the minutes of our last meeting was in August, on the 4th of August, and the minutes stretch out to 1, 2, 3 pages. Unless there is any dissension, I'll take those as approved. Are there any dissenters? I do not think so. Those minutes are approved. We come on to item 4. We begin our meeting proper, and the situational awareness report, local outbreak control update from our Director of Public Health, Dagmar.
Hi and good evening. I think, Clarissa, you will help me with the slides. So obviously, as the subgroup for our outbreak control governance, it's really important that we're all on the same page in terms of situational awareness of where we are in Merton with the coronavirus epidemic. And that's why I'm going to share an abbreviated situational awareness report with you, because I'm aware that quite a number of us are sitting in other meetings as well, and you've heard me talking. And I also just wanted to confirm, or for you to confirm with me, that you are receiving the situational weekly reports, because for me, misinformation, misunderstanding is often an underlying reason why partners sort of can't properly pull together in terms of control. So if Clarissa, if you give me the first slide. I mean the second, sorry, that's just the cover slide. If you give me the next one. So this one, no, go back, sorry, that one. That's our summary. And you will by now be really familiar with this summary. What we have to be aware of, and we all in a way struggle with, that I pull together for you the weekly data. Obviously, I also monitor daily. That's what I'm here for. And so sometimes the weekly is already a bit out of date, particularly during times where there's rapid change. And you will have heard over the weekend that there was quite dramatic change. So a backlog of positive cases had not been fed into our data system. And hence it appeared over the weekend as if there was quite an abrupt big jump in the number of cases. So obviously the number of cases are in the same, but what had happened is it wasn't quite as big a jump. It had already been climbing, but we weren't aware. What the fact of the matter therefore is, if you look just at the right-hand side of the cases, all the arrows are up. And that is quite inconsistent, and it is quite alarming, because we are now in infection territory and in test positivity territory. That starts to worry us in terms of potential impact, health impact. And when I spoke to you last, I had to give you a caveat and said, because testing capacity was poor in London, because testing capacity was stretched, and so it had been a national decision to divert some of London's testing capacity to the north and the northwest in particular, our testing rates had gone down. And so it looked actually as if London's situation was quite steady. But we had some anxiety and inklings that that wasn't the case. And so we, for example, monitor the ONS estimated case rate. And that already had alerted us that things aren't as steady and rosy. And lo and behold, the good news is that in London, testing capacity has increased quite dramatically again. So we've got the testing capacity back. I hope that your constituents have also fed back that it is now luckily easier to get a test. You see it in our summary sheet as well. Testing has gone up. And so we are picking up again many more infections, and probably are now having a clearer picture of where we are heading than before. What I probably also want to draw your attention on is that in terms of situations, the one that Stephen, you mentioned, and Vasa, is we're monitoring whether we have outbreaks. And to be honest, in Merton itself, it says on the key messages, we had 3 new incidents. Our learning is that we have small outbreaks, be it in schools, in workplaces, but nothing that could explain the big increase in numbers. It is normally our incidents and outbreaks are maybe 2 or 3 related cases, but nothing to complain numbers, double-figure numbers. You will have heard that St. Helier Hospital has declared an outbreak. So in their renal unit, they found some related cases. They are on top of it with their infection control now. They're working very closely with London. And the big message for you to take back as well is it is obviously concerning for people. And please, for people not to draw the conclusion that the whole hospital is unsafe and avoid going there when they need the care. One of the big challenges is that people trust the NHS and seek healthcare when they need it. So from a comms point of view, really important. Clarissa, if you give me the next slide. So that slide just shows you Merton was green. We're not green anymore. It has crept up since. You see that London has already some red tiles. Red, you will remember from our previous contain framework. If infection rate is persistently 50 per 100,000 over 7 days, then we are in an area of national concern. And so we are expecting that London will hit that any moment, and we need to be bracing ourselves to reconsider more restrictions. You will remember that London has a commitment to go together, so single boroughs will not be picked out. So it is the average London performance that gets very, very closely monitored. And so I would say watch that space, what might come down our way. If you move us on. So that is just in a way, the recap slide. Merton currently 1A, not anymore. So we have now locally slipped into 1B. But as I said, London is hovering very close to 3 area of intervention. If you move me on. Okay, so if I stop briefly there, just to check out whether you've got any analysis before I want to share a few other slides around testing, because Councillor Stringer, I think you particularly requested in the last Health and Wellbeing Board a little bit more granular understanding of testing. So I've pulled a few slides together for the subgroup on that. But first of all, are there any questions on our situational awareness report?
Una. Una, you need to.
Sorry. I hope you can hear now. Sorry about that. And apologies for being a little bit late to the meeting. I got a bit held up just on the way here. Yeah, I mean, I followed all that Dagmar was saying, and thank you for that excellent report on the situation. I mean, clearly at the moment, Merton's done a jump. I have a couple of things, because Jed puts out a weekly report, which obviously lags the data. Then we get this, which is, you know, a different report. So that's somehow my first question is that as a counsellor, it's quite hard to know what I should or shouldn't be. And then secondly, from the point of view of London, of course, everybody is concerned at the moment as to when, if, what's the likelihood. It's all sounding as if we are likely to have a bigger, you know, bigger restrictions. Some people seem pretty certain that it's going to be around half term. Some people talking about a short lockdown, you know, swift, sharp shock, and then somehow miraculously we'll all be able to get on with our lives. But you know, have we any idea yet? And I guess obviously that's very confidential, and I accept that. But it would just be useful, I think, to know where we actually are at.
Yeah, so I think thanks, Una. If I first respond to the various reports that are now flying around and that are not that easy to distinguish, I completely agree, and we've in a way clocked as well in the council that so helpful. So what we're doing at the moment is John Dimmer is reviewing what we call the COVID dashboard, which gets attached to the councillor's newsletter every Thursday, because that one was also counting infections, but on a slightly different time lag, and therefore caused slightly different figures, which then it's very difficult to pick up what's what. So we try to smooth that out, and also think in terms of the COVID dashboard, that as we are going longer into the next sort of wave, that we want to also monitor some of the indirect COVID impact, so that we're not just looking at infections. So bear with us a little bit. I think the councillor's newsletter will stop for a little while we are rethinking. The situational awareness report, though, is, from what it says on the tin, the acute infection spread, the most up-to-date and reliable that we are trying to share with everybody.
Thank you.
And then, oh yeah, you wanted to very quickly, sorry, Chair, is that all right?
Yes.
To just respond to the second part. We are all in the same boat with you, Councillor Moulton. I do not have any more information. So the moment London information, or London will agree, we will be informed. And if you remember, I shared with you in the Health and Wellbeing Board, it was a diagram with the different stairs on, so how the decisions are fed into the different meetings, and when are the crucial meetings. So there is one for our councillors, and to feed into London, so that the decisions aren't just made by other people. And then there is a process for feeding it back down. So I'm with you. We're all sitting on tenterhooks, but I don't know anymore.
Okay, thank you.
Thank you very much. Any more questions, comments on this aspect so far? Yes, Mohan.
Thank you, Dagmar. Thank you. It's just a comment, really, an observation. So looking at the Pan-London graph you showed, it was interesting to see central London middle's green, the 0.0, whereas surrounding it was all yellow, amber. Kind of, how does that work? And the second one, it was more comment, really. I think it's good that we've got, Merton's well placed. I think, we're testing them to the care homes, and you've picked up 2 care home staff who are asymptomatic, and that kind of helps. Certainly, unfortunately, it's inevitable. You look at the other states, it's all yellow and red with green. So, certainly as this ramps up, I think we're kind of nicely stead for when this does come, that we've got precautions in place, and certainly with the testing ramping up as well. I think hopefully we bode well. So they were just my 2 comments, really.
Shall I chip in? So I think what I call the tile map that shows you London in these different tiles. In some of the inner London bits, so it's city, and city is a bit of an artifact as a local authority. It's only very few people, and it's basically just what it says, the city. Whereas if you go towards Hackney, where we're now talking big outbreaks, Newham, Redbridge, and some of the explanations that are put forward, but by no means are they comprehensive, and we are thinking we've got a total grip, is that it's household transmission, so not huge outbreaks in one workplace, like 1,000 people, where what we had in other areas. So it is community transmission, probably households, and household overcrowding, together with high exposure, low control jobs. Yeah, that is the sort of combination that fires the transmission. But it is interesting to see, because as I said, we are behind now. The map is already out. And while I think Councillor Alan Brittis and his counterpart in Croydon were celebrating that Croydon and Merton were the lowest in terms of infection not too long ago, Croydon is now hit big time. Croydon over the weekend and into this week has very high numbers. So it can change quite quickly as well. So I always say this is what it is, a situational report, but we have to be prepared. And, 16 a day we had today. If you would have given me 16, only 2 weeks ago, I would have had a panic attack. Whereas now I am aware and already in a way prepared that we are following others, but the numbers really are rising.
Thank you, Dagmar. Any more questions or comments of Dagmar? Yes, Abby.
Hi everyone, and apologies from me as well about being slightly late for the meeting. Dagmar, I just wanted to pick up what you said about the kind of comms that we need to be doing, around outbreaks. Forgive my ignorance, but I hadn't heard about outbreak at St Helier, and I just reflecting on that was thinking about, I'm on the receiving end of lots of these updates from yourselves, but also the kind of Borough updates as well. And I was just thinking about how we do that local comms about outbreaks. I think on one hand, as you said, we don't want to frighten people into thinking that they shouldn't seek the care that they need. That's utmost importance. But also just thinking about kind of the levels of trust that people have at the moment. Would there be benefit in actually kind of saying to people, it's completely safe there, but there was an outbreak recently. We don't want you to go into that thinking that we kind of misled you to think that there wasn't anything going on here. So just thinking really about how we're going to approach that.
Yeah, I think it's a really good point, and in a way, I probably haven't phrased it clear enough. That was precisely the purpose of the communication, and because it's really hot off the press, immediately a comms piece was sent out. So Vasa sent it out. We got it also from you, Mark. You sent it out. You mentioned it in Merton Health and Care Together. So our colleagues in the NHS, I have to actually really thank, because from several directions we got the information. So it's in a way a positive experience that immediately as it becomes the situation, and that there is the attempt to use our channels as well as possible. But it's Hetty, I'm looking at you as well, so that we then make sure that when we get it, that we pass it on appropriately. And that's a very valid point, Abby.
Thank you. Yes, Mr. Crewman, Mike.
Mark. Just to build on Dagmar, I think what we have done is we've used multiple routes to communicate out often to other health professionals, because we need to remember that actually walking into hospitals is not what you should be doing at the moment anyway, that your routes into hospitals are either via primary care or through outpatient appointments in liaison with the hospital. So we've targeted our comms quite rightly at kind of our health professionals, as well as doing some general comms as well, because I think in the mass media there has been some misreporting, particularly of this Epsom and St Helier case.
Thank you. Just from me, Dagmar, obviously as councillors, when you mention our wards or wards we live in, we're very interested. So you've got clusters in Wimbledon Broadway, South Wimbledon Broadway, in Wimbledon Park, I think, and in Cannon Hill. Is there a privacy aspect, or are you able to, and you said it's about 2 or 3 people, it's not, you know, clusters worries everyone, but is there a privacy angle for us or the public to know where that is?
Well, it's actually, I've discussed it and raised it with my expert colleagues in Public Health England as well, to say, what do we do with the community cluster knowledge? And it is very interesting to understand that when our infection rate was very low, the detection of a cluster was used as a sign to say, oh, let's look for a source, let's look for an exposure. And that was the main purpose of a rather arbitrary sort of community cluster definition. Now that our transmission is so high, the relevance of the community clusters is less pronounced, because basically what's happening in Merton, like elsewhere in London, is that the virus is now around us. And so in a way, it's a little bit of a lag that we're still looking at the community clusters. And what we then do is to say, was there an event, a common exposure that allows us to see whether there's anything that links these community clusters together. And that's what we are using them for. And we're working with Public Health England, and we haven't found anything. Yeah, so it is in a way the more frustrating bit, that there isn't anything to put our fingers on. And for that reason, we've not made a big fuss out of them, because we just honestly think it doesn't warrant it.
Thank you, thank you. And just a little history lesson. Oh, Una, Councillor Una Moult.
Sorry, just following on from that, and briefly, I mean, obviously it's a concern. I just heard my ward mentioned there. Irrespective, I'm not mentioning wards, should we be putting out something to warn people that Merton generally it's on the rise? Because I don't think people are too aware that it really is. For instance, I'm verger at a local church, and we're doing 3 services a day on Sunday plus evensong, and so should I be warning the vicar, for instance? I mean, it just strikes me that people are starting to feel that we can have some semblance of normality within reason, and that's what we're all been trying to support and stay safe. But if it really is in the community and in Merton, as you've just stated, Dagmar, should we not be putting out a little bit more warning, of more vigilance? I mean, I'm not saying don't go to church, I'm not saying don't go to your pub or whatever, but shouldn't we be warning people that little bit more?
Yeah, I think it's a good point, and maybe we can get into the details how we do that well in our roundtable update that we have a bit later, roundtable discussion. Just to pick up, Hetty just put something in the chat as well. We do communicate over the social media what's happening in Merton, what's happening in London. Also, we've very much promoted the app. So all of you who have an app will see that if you actually look at your own area, it will tell you what the risk is, and it used to be low and it's now medium, wherever you, depending on where you live. So it is around us, but I think it's a good point that we probably log for our round table to say, how do we get the messaging right without frightening people, but making them aware that community transmission is happening. I think Mohan, you wanted to also come in.
Yes, okay, Tim. Yeah, I agree. I think it's I don't think it needs to be that complicated. I think it's getting the right basics right, the principles. You know, washing your hands, making sure you social distance, making sure you wear your masks, making sure that you use the app. And I think even though you walk around and you see people who aren't observing that, and that is the basic principle. That's what we've been saying for the last 6 months, and that's not going to change. So I don't think there's a new recipe or there's a new message we need to send. It's just the same old. Unfortunately, it's not gone away. I think we're functioning now, so schools are still, you know, opening. We're still going to work and doing stuff, but we're being a bit more aware. But we just need to tighten that screw now that this second thing's amongst us. So I think it's just getting the basics right. Thank you.
Pasa.
Thank you, Chair. Yes, we must let our public know that things are not as good as we wish them to be, but we have to get the balance right. So on Saturday, not that far from Cannon Hill, Lower Morden, where I work in, we ran a flu campaign. 200 people came. We staggered them from 9 o'clock to 4 o'clock. They were distanced, they were masked. Now, next Saturday, we want to repeat this because we have a long way to go to reach our target. 200 is just a small dust in my target. Now, my concern is that once I say Cannon Hill, Lower Morden, around the corner, then suddenly, I don't want next Saturday's flu campaign to fail because people are scared to come and stand in that queue. We stagger them on an hourly basis. And there are at most not more than 10 people standing 2 meters apart in our surgery car park. But even that, we've got to get the balance right. Otherwise, I will destroy that campaign of mine. So this is our tension.
Thank you. Hetty, can you tell us the number of people that get a newsletter via social media?
Yeah, people sign up. So we had everybody on the COVID-19 newsletter list. Some of those people have now about sort of 10, I can't remember the exact figures. Some have now unsubscribed because they don't want to hear from the council. So, but most people do get that. Social media wise, I think we have about 20,000 followers. So it doesn't reach everyone, and nor does everyone look at the website. But what we're trying to do is, as Mohan said, get the basics right, get the information up on the website. And one of the changes I'm making this week ahead of any potential local tightening and restrictions is getting the local area data for COVID, which is just easy to map to and embed in the website. So people can go on a website and they can see where is Merton in this, because people are very interested to know what our rates are.
Thank you. Okay, shall we thank you for that, Dagmar, and thank you for everyone's contributions and questions. Shall we move on to our next item, which is item 5, engagement, insight, work with our communities. And this is a trio, Dagmar, Barry and Rob.
Chair, is it okay, just to let people know, I have put a few more slides into your pack, mainly for reference, around the testing pattern in Merton, because it was, I think, Councillor Stringer who particularly was interested. And the key messages you find about where people from Merton get their tests, which I think is really important for all of us to understand. So it's roughly a third home testing, a third go to the big regional testing sites, and a third go to the MTU, so the mobile testing sites that come every 3 days, and it's now in Kenley Road. And that hasn't really changed over time, but you will have been aware that Merton now has got a local testing site. It's near the college. It had a little bit of a turbulent birth, let's put it that way, but we've got it now, and we're very proud and very glad to the college as well. We're working very closely with the college. At the moment, the booking is still all through the national portal, and we want to keep it like that until we are really happy that we have got operational experience. But slightly longer term, this is a real advantage for Merton, that we've now got a testing site that is for walking rather than big drive-in, in an area that is easily accessible, that is close to the college, where we know young people have often got COVID symptoms. And in order to inform even future, we might look at further local testing sites. It is important to understand how people access the test. And so I won't go through all the slides using up our precious time, but I thought you might find them interesting. Seeing various uptake rates, including really interesting, you will see the abrupt drop of testing that we saw 2 weeks ago and the pickup now. And it gives you also an overview is system. And although we're below 80, which is meant to be the good standard, we are one of the highest in London. So take that as a possibly reference document. And then if more questions pop up, do just send me an email. Now we can go on to the proper engagement stuff. So that's very, very quickly. I'm handing over in a minute, so you get a break from my voice. This is our key business. It's around community engagement. Just very briefly explaining how we think this session will work. We give you a little bit of update on progress. Then I'm very grateful. Rob is a sort of exemplar almost, how he's worked with the community to get some insights, because our premise is only insights and trust with the community enables us to then land the messages about protection in the most effective way. So our after you've had a bit of update and hear from Rob, we then have some time to discuss and hear from all of you what you've done and how we can help each other to fulfill our leadership role. As a recap, there is clear evidence that the community engagement building trust aspect anytime trumps enforcement. When we think in terms of effectiveness of control, you cannot enforce yourself out of a pandemic. You have to have the community with you. Really, really important that we remember, and I don't think any of you needs the reminder, that we have absolute strength and resourcefulness in our community. Let's not underestimate them. So we work with them. And that we are very aware that the COVID pandemic is affecting everybody in the community, but there is a disproportionate impact on some groups, and we as the community subgroup have to be absolutely committed to in a way ensure that in the second wave those particularly vulnerable communities are protected. So that's just a little recap. I'm handing over now to first Barry and then Rob to share a bit of update and learning. Barry, that's you.
Thank you, Dagmar. So as Dagmar's touched on, I think it's really important that working with the community is a key principle of outbreak prevention and outbreak control. So what I've done, I've picked up some highlights. These are very brief overviews of some of the work that we've undertaken so far. Really pleased to say that a lot of this, if not all of this, has been worked in partnership with the local NHS. So to pick out some of those highlights before I go on to the initial findings of the conversations we've had with the community. We've held community engagement workshops, and many people around the table this evening have taken part in those. And these have really identified key assets, and we have a huge amount of assets within the community in Merton to build upon, which then we can use to inform our comms and engagement through this group. Really proud of what we've done on the network of community champions. Again, we've got people around this table that are members of our community champions network. Essentially what happens is every week we have drop-in sessions. So we have one at lunchtime and one every Wednesday evening where we discuss with our champions a key theme. So we've spoken about the app, we've spoken about the latest guidance on the rule of 6, for example. And then we share those resources with our champions on a Friday afternoon so that they can send them via email, via social media, or WhatsApp to their friends, their networks, and their families to reinforce those messages. Really pleased to say we've got over 66 community champions signed up so far. And I'll come back to that a bit later because I really do need the support of the community subgroup to increase the reach of those champions. We've also commissioned BAME Voice to do some work to really engage with communities across the borough to understand the impact, but also to build resilience in those communities to increase those awareness of key messages. Going through quickly. Again, we've seen, and we're going to hear from Rob shortly, but our voluntary sector organisations have done some really positive engagements of communities to identify some case studies that we can learn from. Some of these case studies are really difficult to read. These are our residents that are really going through some difficult struggle times, but we've got those services in the community hub to be able to support them. Martin, I don't think is with us this evening, but Martin's one of our wonderful young inspectors. Martin, you might have seen his video recently encouraging young people to download the app. But again, we're building an action plan to engage with young people to really understand how COVID's impacting young people. And again, so that we can build on the resilience and to get those key messages out to young people across Merton. We're also working with our colleagues, so got 2 GP colleagues with us this evening in the NHS about COVID Fit, and this is about working to mitigate that health harm if people get COVID-19. So to stop smoking, to lose weight, to manage your long-term conditions. And these are the evidence-based approaches that we're rolling out because we have good services available within Merton to support people to change those lifestyle factors. And again, really pleased to say that we've allocated some of our local outbreak control funds to directly go to the voluntary sector organisations so that, again, when we've got key messages, whether it would be about cases increasing, whether it's about a local testing site, so that we can reach into those important communities within Merton to get the reach of those messages. There's far more going on than those 7 or 8 slides. For example, on Friday, I'm meeting with representatives of the Polish and Eastern European communities because they fed back at one of the community champions meetings that they didn't think that they wanted more voice. They wanted to be heard even more. So I said, absolutely, let's organise a session. I'm happy to listen to those concerns and those questions. Next slide, please. And I'm just going to pick out some of what we've found. So I'm not going to go through all 12 of those, but what we've heard from communities, and I've heard these a number of times, is that all groups are worried about mental health and social isolation. Lockdown was really difficult and really challenging for all of us. And so the group said, tell us more about the services that we have and how we can access support for mental health. So our community champions meeting tomorrow is focusing on mental health. So we've got guest speakers on mental health. So again, we can talk those things through. We've heard from the community that many of our services have done fantastic work to continue delivering through lockdown. So that a lot of those services went digital only because that was the only way at that time they were able to do it. And I guess we've heard that digital is a huge enabler for many groups and many people within the borough, but it's also a big barrier. So again, when we're thinking about opening up those services, we need to make sure that we can open those services safely so they're not only digital, although there is very much positives for digital too. Residents, members, people that we've spoken to have told us about healthy lifestyles, again, linking into that COVID fit approach, an increase in alcohol use, being less active because being less likely to go outside, and then putting on weight. And these healthy lifestyle services, as I've touched on, we have good services. It's about connecting our services to those residents that need them. Really interestingly for me, and again, this is hopefully what you've seen, is that what our residents and the people we spoke to have told us really clearly is that They want to hear Merton-specific messages. They don't want national messages. And so again, that's why we've got videos of local GPs, Mohan, local young people. We've got Martin giving those examples. These are trusted local leaders and place shapers to be able to deliver those messages. Final two things I'll kind of pick up is that on the right-hand side there is that the community came to all the engagement events, the community champions meetings, saying, we want to take a part in this. We want to work with you. Give us the messages, we will get them to the community. And also, as I've touched on this already, but we've got a huge amount of assets. So local leaders were telling us, we've got the fantastic faith group networks. We've got mutual aid, which started from very little. We've got the Dons network, which has been doing some wonderful things. And again, it's how we build on those assets that we have to get the key messages out. So I've kind of touched through what we've done so far, but there's more to come. I've touched on some of the feedback that we've heard so far. But now I'll hand over to Rob Clark, and Dagmar's kind of touched on this. Rob is a member of this group, and he mobilised very early in the pandemic, identifying and seeing the impact that COVID was having on the groups that he works with. And so he's going to present some of the findings of that, but also give some thoughts on what we need to do now. So I'll hand over to Rob, if that's okay.
Thank you, Barry. Now you'll have to forgive me because I can't actually see the screen that Clarissa is sharing. So I'm gonna refer to the slides that I've got here. But Clarissa, if you could just move to the first slide on older impact summary, where the headings the lived experience of COVID-19. I just want to talk a little bit about methodology without boring people to tears with the kind of science behind it. But from an older person services charity, a provider, we wanted to understand as soon as we possibly could the impact of COVID on our clients. So on the people that we are kind of serving within the community. And we wanted to look at that, not just in terms of the direct impacts of the risk factors of COVID itself, but looking at also the impact of COVID as a wider kind of issue. So the indirect impacts as well as the direct impacts. So what do things like shielding and self-isolation and all of the fear and anxiety that exists in our community, what is that doing to the people that we support? And so in order to do that, we decided not to send out a survey, but we decided to really kind of temperature check with the people that we were supporting on an ongoing basis. So across the year, we support anywhere between 2,500 and 3,500 older adults, but a lot of those people we are in relatively regular contact with. And over the COVID initial phase, that was about 750 older people. And we were seeing a number of emerging issues, increased demand from those people, but also a number of new people. And so what we did to really understand what was driving that and what people were kind of encountering as a result of COVID, we asked our staff and our volunteer network to provide feedback into us. So I set my staff team off on a little mission to kind of pull together the themes and the things that they were hearing from our clients. And within that, we pulled together, I think it was at least 10 case studies of the people that we were supporting throughout that period. And in doing so, we were able to capture that lived experience. So we have all of this data flying around, but actually what can we learn from what residents are telling us and what their experience is? Because we can learn as much from that as we can from the data. And so in doing that, we've been able to capture these kind of common themes that I won't go through in great detail because I talked about them in more detail on the Health and Wellbeing board the other day. But what we've done with that is then been able to analyze kind of the themes that are emerging and then talk as an organization with internally and with our partners about how we can actually address some of those issues. So the things that we've identified, broadly speaking, are around social connection and mental well-being and all of the impact that we've seen in those themes. Next slide, Clarissa, if you would. And then issues around affecting older people's physical health. And there's a number of things within that we've encountered as problems and things that have kind of accelerated issues that people might normally be facing in later life anyway, but COVID's rapidly increased those issues. And then finally around things like finance. So what money have people got to be able to support their own health and well-being, anxiety around job security, loss of income from pensions, all of these sorts of things kind of coming to the fore. And like I said, I'm not going to go into detail about those issues, but what I want to talk about is how we've actually used that piece of work to really then identify the learning points and the solutions. So Clarissa, if you could just go to the next slide. Thinking about what we can do as an organisation with our partners to provide that community response. So what's the learning on what's needed for that direct response to say, okay, if restrictions increase again, what are the needs that we're going to see again? So is that around supporting people to get basic support, the shopping, the emotional support, the practical support to help keep them safe and independent? And then also looking at that kind of wider indirect aspect of it. So how do we take as much of the sting out of the tail of those issues that I've just touched on before with COVID? So I think Dagmar refers to it really well with collateral damage. So how do we go about as an organisation providing that meaningful social connection and to help people stay, I guess, hopeful about the future, connected to their community and feeling like someone cares about them? How can we build services and keep people kind of distracted from the wider world, so to speak, and give them things to kind of keep them occupied, as opposed to watching the news all the time and thinking that it's all horrific and traumatic, which invariably there are issues out there, but actually, you know, what can we do to try and distract people from that? And then as an organization, using what we've learned there to say, okay, there's going to be increased need. We're seeing it already. How do we build capacity within the organization to help people navigate this situation, to connect them to the services that are there in the borough in spades? There's such great services in Merton, but people don't often know that they're there. So how do we go about helping connect people to that? How do we, as an organisation at Age UK, build capacity to provide that practical support to help people stay independent and that sort of thing at home? And then how do we keep people active? And then looking as well at what are we as an organisation going to need to do to support our workforce so that we can get through the next 6-9 months, however long it is, because we know it's going to be quite an arduous winter. How do we make sure that we've kind of got all of those systems in place to support our staff and volunteers to provide that support? So hopefully that gives you a kind of understanding about how we've used that lived experience, captured that information from our community, and it's an older adult community across the whole of the borough, to then put things in place to say, this is what we're going to actually now do about it. I think I'm handing back to Barry. Dagmar.
I think it's back to Dagmar.
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 So, Rob, thank you very much. And now you will understand why I say this was a sort of an example of really community subgroup in action. And in our next item on the agenda is a bit more of an open roundtable discussion. Whether we've got Cass, for example, on the call as well. We've got Abby, we've got our councillors. So what we would like to hear is going round so that it's not just us talking. 3 things to possibly structure the conversation a bit. Is there anything from your end and angle, what impact you've seen in the community? That you think as a community subgroup we need to focus on, and it could be something bad that we need to try to mitigate, some misunderstandings, some miscommunication, possibly some myths, or something to amplify, some great spirit, some volunteering community action that we could amplify. How can you help us to connect with others, particularly to have more access into vulnerable communities that do not normally are very engaged? So probably our problem. I thought the example from Barry around the Polish community actually knocking at our door and saying, you know, we're also here. Please don't forget us. I think we've really taken more active efforts to reach out into the Tamil community. So you might think and bring your own insights. And then how can your work link specifically up with our primary care networks? And we've got Mohan and Vasa here, because in a way proudly and really great that the primary care networks are committed to reduce health inequalities. The local GPs are part and parcel of the community, and so it would be really great if we as a subgroup could hardwire sort of connections between primary care networks and community influences. So that's just to set the scene. And I think, Stephen, you will help us to facilitate a bit of a roundtable discussion.
Yes, thank you, Dagmar. So we're not going into breakout sessions or into other rooms. We'll all be here together. And why don't we start with our doctors first, with regard to some of the issues with regard to diabetes and children and flu jabs. So Vasa is top left-hand side for me. Then I'll go to Mohan. Vasa. And Mark later. Yeah.
Thank you. I think the challenge for me would not be to immunize more than 1,000 people with the flu vaccine. That to me is an easy job, because that is very doctor centered. I send 1,000 texts, I send a few reminders, and I know I'll achieve that target. But for me, it is the people who will miss out on my services. So the people with diabetes who have heard me talk about diabetes for a long time in my lifetime and theirs, but still haven't made that crucial step to determine how the culture impinges on the diabetes, because the culture leads to the kitchen and the fridge. There is a connection between these three things, and unless we can work with our communities in the kitchen and in the fridge and in the local Tamil shop, if you're Tamil like I am, unless we connect this together, we are going to miss out on that cohort of people, and they pay a heavy price when COVID comes to meet them. And I think that is the message. We need to be very clear how each community knows what our secrets are and what our temptations are. And so we have to connect to them in their language, with their culture. And I think the key message for me is that culture is a very sensitive topic. It's a very emotional topic. It's a very personal topic. And how we enable people to still hang on to the culture, because culture is my identity and you can't steal it from me. But my identity is now killing me, and that's the issue. And I think how we work to get the message across to them that you can still eat all the Tamil stuff which is lethal for my diabetes. I don't have diabetes, but all the Tamil stuff which is lethal for diabetes, how you eat that in moderation, so that you still hang on to your culture, but you survive diabetes, complications from diabetes, and adverse effects from COVID. And that is the message which I met Barry a couple of weeks ago, and that's the message we want to take out to the community, to get it across to them.
Thank you. Mohan? Yes, no, that's very helpful. Mohan.
How long have we got? I mean, I could talk for an hour for those three bits, but I'll snip it down to a couple of minutes. So, you know, what impact have we seen in our community positively? I mean, I think COVID has really brought the best in our community. It's got people doing things which they weren't doing. We're having lots of conversations, and actually it's really empowered it. We've had lots of volunteers come out and support general practice, as well as the Don's Action dropping off medication, and the other volunteers attached to COUNT as well. So we've seen a real community spirit coming along. We've unfortunately also seen some isolation get worse, domestic violence, alcohol get worse, and gun crime certainly as mental health has been deteriorated. So I think it's a two-edged sword, isn't it? We've seen some real good collaborative working, but we've also seen some real bad traits in our local community come out, and how have we been able to tackle that? It's quite hard without having the resources we've had. How do we connect with the vulnerable groups? I think doing more of the same thing is not going to work. I think it's about having these key conversations with different stakeholders. So this morning we're having a conversation with the Football League, and in particular Fulham Football Club and the AFC Women Foundation. And they have a massive reach, and Barry was on that call, and an absolute massive reach of patients who don't come and see us at the practice because they don't want to come and see us at the practice. And vice versa, they get patients who they want us to see. So I think it's having those conversations and us doing an outreach to the football stadium and maybe Kings Meadow or the Plough Lane, just to sort of talk about, actually, while you're here, could you do this health improvement project? Or we thought about doing your PSA checking. And I think that's some of the vulnerable groups, or the hard to reach groups, I should say. So I think continuing to have our conversations can certainly help target those. And Bassa talked about the town community faith groups as well. Those leaders who really can impact and influence and advocate what we're trying to say. So education to our general public about what choice to make. And then finally, the primary care networks. We looked at flu jabs and vaccinations, and I think they're outcomes actually. And I think what's more important is actually the why bit. So why we actually got these networks and we've got this population health. And if we get that correctly, we get that done right, integrate well. The social prescribers have allowed us to integrate with our community. There are new roles coming out, health and wellbeing coaches, care coordinators. I think we can get this team together along with some of the other roles, and Rob was looking at a pilot with Age UK as well. If we can try and link all these dots together, I think that will really empower and build resilience to our community. And that will embed personalised care, not just for diabetes. Diabetes is a high prevalence in medicine, but there's lots of other medical conditions which also need to be looked at. And I think if we get that bit right, that will work for all conditions. And then that will have an impact on smears and childhood vaccinations as well. So I think it's all of those, linking in with the networks, linking with one sector, public health, doing is what we've been doing and evidencing it as well. Because I think we sometimes may need that sort of leap of faith and also that sort of evidence to show actually what we're doing works, and let's keep going. So there are my small snippets in literally a few minutes. I could talk for a lot longer, but I won't hijack it.
Thank you. I'll try and mix it up a bit. Abby, did you want to come in from MVSC?
Yes, thank you. I'm glad you brought me in there actually, because I was just going to echo that point that Dr. Mohan just made about faith groups and kind of, you know, faith leaders being a big kind of influential group of people that can, you know, encourage people. And I think Councillor Moulton made the point earlier as well. I think when I think about my own kind of really small local community and people that I know in my networks, one of the first things they were worried about kind of but also kind of keen to get back to was church. They're not worried about kind of when they can go back to work, but they're really, you know, really missing that community spirit, that connection with people. And I think, yeah, that kind of group is a big and key stakeholder that we should be working with and listening to. Similarly, you know, other stakeholders in similar areas. That was the main point for me. Thank you.
Thank you. I wanted to go to David from Health Watch, and then I'll come to Mark. David, do you want to have your input?
Yeah, mine again, on the back of Vasa and Mohan and also Abby, all of that just echoing the same. You know, a lot of positive stuff coming from public health locally. You know, you've given us a good bit of information update and stuff and communication flow. The only thing that on top of that is proven difficulty, given the day and age that we're in terms of social media and that, is being able to give people updates on how they can access their GP and which way they can access their GP, which ones are open, what services are available, when are they not available. And I think that to me is what a big frustration is. And I don't know if it's something that can be fully solved. It's just one of those things. I think we're always behind it because of how quick things change. So if you look forward and we suddenly go into a mini lockdown, what's that going to do? What messages, or how are we going to communicate that pre that happening or post that happening? And it's mainly about access to services and non-COVID-19 services. When are they, you know, in terms of the hospitals, what's information live now? And it's like even taking what Dagmar was saying earlier, you know, we get the briefings, but they're already out of date before they've got to us in a way. And I think it's like how, if we can partially solve that puzzle, I think that will help the trust and gain that mutual, I suppose, benefit with the community, that we're actually doing our best to get that information out to them, not just gather information as well.
Thank you. Mark.
So I would echo everyone's comments about working together in the voluntary sector and public health and also health. I think there's some challenges there for us though, because I think particularly around things like communications, what we really need to start to think about is how we communicate in a very different way with our different cohorts. And that kind of like a previous, and I don't mean this of Merton, and apologies because I am new, but there has been lots of kind of Eurocentric kind of communications about immunizations and why people should be immunized, and it doesn't necessarily work, and it doesn't necessarily really address the fears that some of our cohorts have, and that includes things like care home staff and flu vaccinations. We need to get much cleverer about the way that we communicate. And then I think there's also, just picking up the last point about how do we communicate access, we have a digital revolution going on with people accessing services and care, but it doesn't suit everyone, and it's not necessarily about just having the kit and caboodle. It's about having the quality of the interaction with your clinician, and that might be on the telephone for some people, it might be on a Zoom call for others, and we have to think about providing access on numerous channels so that we start to really deliver kind of choice to our communities as well. So I think that's probably the areas I just wanted to raise.
Thank you very much. I'll go to the two councillors and then I'll come to you, Rob. Okay. I'll go to the two councillors. Ellie, with regard to children, that year one year old service and care they need, do you want to have some input? Plus, obviously, your engagement within the community.
Yeah, I was going to talk about schools and youth services, unsurprisingly, but I'll echo what lots of other people have said about the community. So one thing I was going to say is, schools are kind of hubs in their community, and they do a lot of communication out to parents, and they've got very used to having to put very clear comms out to parents over the past few weeks. And I was wondering if there's more that we can make of that, always with a slight concern about not wanting to ask schools to do more. But for example, schools are at the moment getting their kids signed up for the flu jabs, the flu nasal sprays that they give it to younger children in primary school. At the same time, could they be putting out a message of, and if you are eligible for a flu vaccine yourself, why don't you consider doing this? And just reiterating, this isn't something just for your children, but you to think about as well. And I think really, I suppose the message that I haven't heard coming through yet is that one about just keeping yourself healthy is a good way of protecting yourself from COVID. So I'm not, being critical of anyone here, but that hasn't been coming through in the kind of like community health stuff that I've seen. And again, schools could be a good way to get that out. And youth services and youth advisors, I think our youth advisors were already doing some work about promoting positive messages about immunisation through young people. I think young people are very well educated about their health at the moment, and they can then pass that on to their families. So more work with those. One of Dagmar's questions was about any myths that we've heard. So I'm going to raise one that I've heard as a parent as well as a kind of cabinet member, of when there was a case at my daughter's school. It was very clear that only the children in that bubble had to self-isolate, so they had contact of a confirmed case. That was incredibly clear, and everything the school put out really clear from the wider conversations I was having with officers. And yet still you had parents saying, well, I'm going to keep her sibling off just in case, and things like that. And I've been trying to kind of counteract that in just my own kind of communities, but that's something that's, we're going to have more and more cases. So we really need to make sure that message is hammered home, that only contacts of confirmed cases need to self-isolate.
Thank you very much, Ellie. I'll go to Councillor Moulton now.
Thank you. Yeah, I think I pretty much said what I was saying earlier. I really think getting out clear messages into the community, I sort of echo what Ellie was saying. I think it's really important that messages are fairly clear and sharp. I think we should be quite honest that Merton is on a rise. I think because it's been great that we've been low, and we still are low, but I think there's too much of a message that I'm hearing in the community that we're low, and there is a certain complacency. And whether I'm, in the church, whether I'm, and I have been very local, so it does tend to be you know, what I'm hearing coming back to me is, oh, well, we're so low, we're okay, sort of thing. And I think it's very easy, particularly with everybody in friendship groups, and you know, whether you're a mum at the school gate, whether you're somebody on the older spectrum meeting mates down at the local cafe or the pub or wherever, to get closer and feel that, well, we're okay, we're in Merton, we're fine, we're wherever you are. And so that's really my message, to make sure, keeping it simple, not frightening people. We don't want to put people, you know, into their room terrified. But I think we do need to make sure that people are aware that this is now in the community, and that people do need to be putting on their masks and washing their hands and doing all these things which are keeping us safe. And you know, people should have been washing their hands for years, but you know, somehow the message got lost along the way. And so it's just reinforcing it, I think. And if churches or mosques or, you know, the Tamil community can put out things in there through their communities, because there's all sorts of newsletters and all sorts of things, you know, and I think it's just reiterating what should become quite an easy message. But we don't want to scare people, but we just don't want people too complacent. I think that's and that's my concern at the moment.
Thank you. Thank you. I'll go to Rob, but after Rob, I just wanted to ask Barry and Hetty. Barry on engagement. If you can say a bit about COVID champions and anything you've heard that's added something to your thoughts, and Hetty on whether, you know, on communication. But first, Rob, and then I'll go to Barry and Hetty, and then Dagmar, if you can wrap up, as it were. But also, I'll open it up to see if anyone disagrees with anyone. So, Rob.
I'm happy to disagree with everyone, Chair. No, actually, what you've just said is kind of the point that I wanted to raise, which is around that kind of difference between comms and engagement. So the comms aspect of it is the clear messaging, that it's almost the transmit. And I think that's really important, that we have that consistency of message. But I think what Merton is doing quite well, and I know through the Age UK network, what's happening in other boroughs, the work that sort of Barry and Dave and Kaz are doing around engagement is actually listening to communities. And I think that has got to be the fundamental part of that. And that's how you win over. So you can demystify some of the myths that Councillor Stringer was talking about. You can kind of almost challenge those perceptions, because people might read something somewhere and form an opinion that's completely inaccurate, but that's just becomes the opinion. But unless you listen to where that's coming from, understand the barriers and engage with people, it's very hard to then kind of actually get that sort of throughput into making that change. So things like, I mean, Bass was talking about diabetes, it's very true in those cases. You have to get in there and you have to work with communities. So that engagement and outreach is what's going to get us through this into communities that are seldom heard. So that was one thing I wanted to just say and kind of reinforce from the work that we've done, which is, to begin with that lived experience, we just listened. So we said, what are the issues that you've been encountering, and how can we as an organisation support you with that? And unless we do that, we're not really going to get anywhere with any of this, because that's not where you get change from. And then I think the final thing is, we know that we have to deliver services differently. So at Age UK, we've completely transformed and reimagined our services, because we know that we can't gather groups together and we can't deliver social connection in those ways. So we know we need to do it, but we need to work out how we do it and make it safe. And so some kind of fresh thinking about how we take services out into the community to make sure that the most vulnerable, the most at risk, the people who are most impacted by COVID aren't just forgotten about and left, because they're not coming to services themselves. So we have to be very proactive with this. And that's probably all I would say at that point.
You're on mute, Councillor.
Sorry, so now I'll ask Barry and Hetty to come in on engagement and communication. I know, Barry, you've got another section to do for us, so I'll let you scribble. I saw you scribbling there. Hetty, on communication, just a few points from you. Have you heard anything that could improve our communication?
I mean, Barry will probably pick up some of it in terms of my interactions with the community champions as well. We've had very good response to the video we did with our young inspector, Martin Miranda from Pollard's Hill. The only negative stuff we have is like really local complaints, like, oh, the co-op in Pollard's Hill aren't doing anything to make people wear masks. So it's stuff like that, and it's always very local, obviously. But it's good that we haven't had any, but you know, nothing negative about this is why you're doing this. Like this doesn't, you know, make sense. So we have another video coming next week on business regulations that was done in Colliers Wood and Wimbledon businesses, and we have some stuff around downloading the app in our 4 core languages, which are Tamil, Urdu, Polish, and French. That's coming the week after.
Thank you. Well done, Barry.
Thank you, Councillor. I think the Community Champions has been really positively received. I think, you know, I said earlier, we've got 66 so far, and that is building. And I guess we've got champions that cover the entire borough. They're covered different ages. They're east and west of the borough. They are LBM staff, they're CCG staff, they're residents, they are councillors, residents associations, they're faith leaders, clinicians as well. So we've got an interesting mix there. And what's been really helpful and interesting is I think it was Rob that picked it up, it's just listening to local people, and so we've listened to some of those myths, we've busted some of those myths, but we've also helped clarify some of those guidance. You know, the guidance can be quite difficult to understand sometimes, so we've tried to unpick that to make it as simple as possible so people can follow it, such as the rule of 6, for example. And I think it's been well received so far that we've also expanded that network of community champions. So it's not just LBM, it's just not public health, it's not me every Wednesday night talking about these things, it's a community response. So we've got mental health, so we've got NHS providers on tomorrow evening's call. The week after that, we've got the Metropolitan Police taking part in an engagement and an enforcement with our regulatory services. So again, we can start to build about the community links that we have, because I think it's going to be listening to and working as partnerships that's going to help us going forward through a difficult autumn and winter.
Thank you, Barry. Dagmar, if we can sort of round it, but please, you know, if other people want to come in. Ellie talked about, we haven't said too much about health, and I remember Jed talking about looking after ourselves as well. The doctors taking enough breaks themselves so that they can be fit and ready to take on and look after their patients. Are we sorting out our mental health services to people, not just to elderly people, but to children as well? So do you want to come in on that, but also anything you've heard? And I've got one idea for our restaurants and takeaways, and yeah, go on, you Karen, I'll tell you the idea later.
Okay, so I wouldn't attempt to summarize, but I'm glad that Barry and Clarissa are scribbling, so we are obviously taking all considerations seriously. For me, what really stands out is that as a community subgroup, how we can help each other as well to amplify. And what I've heard today, what I'm hoping is one of the outcomes and actions is that you use your fellow community subgroup members as helpers and supporters, and do the work outside the meetings, and where you haven't had the connections and now you think, oh, you know, hasn't Abby got some links that I haven't quite applaud. Mark brought in some insights from the NHS. Have I got them all? So we can sweat now that we are a group that has met the second time, that all has a different perspective from the community, that we amplify and use each other. And if you need any support, do come back. Barry and the LBM team is a sort of pivot. The other thing for me, listening and taking all the insights, which I think are absolutely the right thing to go, listen first, be humble. When I take that into consideration, one of the things that stands out for me is that all the things that we ask of people in terms of restrictions in their lives, do this, do that, it has to be done as an ask that comes with the explanation why. And I think we often jump over that. You know, at some point there was a why, and who breathe that take it for granted, but it gets very easily disconnected. And people are quite good to point it out, because the issue around whether the contacts of the contacts also need to self-isolate, that is a very legitimate and logical thought. It's not just a stupid myth. We haven't explained what is our thinking, what is our rationale, how do we think this virus transmits, how do we think what we're doing is stopping the transmission. And that, for me, in terms of the narrative that we use with our communities and stakeholders, we could strengthen that. And Hetty, I think we've already done some really good inroads. And your experiences with your listening will help us to sharpen it even more. So that is, for me, just a little sum up, but obviously not really doing justice to all the richness of discussion we had.
Thank you. We've got a few more minutes on this item. My idea, taking on Ellie's point about healthy, keeping ourselves healthy, and I saw the issues we have with diabetes amongst certain communities, but also generally throughout. It's a silly idea, but I know that Dagmar, you've worked closely with our foodie restaurants, cafes, takeaways, and so on. But with regard to the actual sitting down at a restaurant, is there any way in which we could look to urge the owners or the proprietors to do away with the condiments, the salts, the sugar, the brown sauce, the red sauce, the vinegar, so it doesn't appear? People can take their own if they want. They can take their own, because you can't stop that. But the look of people, you know, traipsing around with their bottles of brown sauce, it's just an idea that you could look at, because I know you've done a lot with shops. Did you want to respond to that crazy idea?
Very, very briefly, no idea is too crazy to not be considered. And I think, yes, we have already, as you well know, a lot of engagement around healthy catering. Again, as we've sensed here, tuning into what matters to people, how they live their lives, what they like, what they dislike, so that we're not becoming the zealots or the police who know it all. That is very, very important, but equally bringing suggestions, increasing knowledge, where the problems really lie. That way we find a co-produced healthier solution. So Barry has really good links into our work with catering, with our regulatory services. So we take it up again.
Thank you. Okay, so we're coming to the end of this roundtable discussion. Something they've forgotten, or they want to agree vehemently with someone else. Vasa.
Yes, thank you, Chair. I really want to reassure you that the very question asked about the bubble in the school is the very question I come across among my medical peers. So we mustn't feel sad or bad or guilty or inferior or any of those emotions, because we're all human. So I don't contribute to doctors' WhatsApp because there are too many WhatsApp groups for medics to join, and there are too many comments on them. But I assure you that very issue has been raised a number of times. Medics are asking each other, what do I do to my child? Because you know what, we may be a doctor at work, but we are mothers and dads at home. And that's really, really important to remember.
Thank you very much. Thank you, Vasa. And now we come to our last item, which is training and communication. It's an offer of opportunities for subgroup members by Barry.
Thank you, Chair. Thank you, Clarissa. Next slide, please. This item is really I'm going to listen to you again, a key theme this evening, really about thinking about, so how can I and the rest of the LBM and the NHS teams work with the members around the table this evening? So how can we work with the Health and Wellbeing Board subgroup to help us deliver and develop those proactive comms, whether we're talking about resources and images on the rule of 6. We've got some videos of trusted local leaders we've spoken about already, but how can we get more of those proactive comms with local leaders in them? How can the Health and Wellbeing Board subgroup help us to increase the reach and the effectiveness of those community champions? We've got 66, we need more to get that reach. But really importantly, how can the Health and Wellbeing Board subgroup, having listened to Rob's example earlier, really establish an ongoing dialogue with the community? And the key word there is actually, that's not in bold, is ongoing. So it's not a one-off engagement. It's about actual dialogue with the community to really understand that lived experience, prevent outbreaks and mitigate the harm. So that's the question. How can we work with you as members of the board? And also, what else would be helpful for you to be able to deliver engagement and leadership on this agenda? So again, it's over to you to tell me what you need.
Thank you, Barry. Thank you for that. Any uptake for Barry? You bowled us all over. I'm sure we'll think of things and come back to you. Vasa. And then
Barry, I think the mistake is that we don't trust the community enough. So I think we need to democratize the health model. The health model is an undemocratic model where the power is centered with me, and there's a democratic deficit there. So the people who have the disease, the community which suffers the burden of the disease, needs to own the disease and needs to come up. It's a bit like diabetes, of the people, by the people, for the people. It's really the people is the key word. They're not diabetes. And I think we need to flip the story. So really, I should shut up. The community knows enough and more about the consequences of the disease, the burden of the disease. My role is just to facilitate a discussion. But the ownership should be taken away from me completely, so that I come in to facilitate a discussion, not to try and steer a discussion. And I think unless we come to the point of what I call diminish the democratic deficit and make health and well-being a community issue and not a health issue.
Interesting point. Ellie and then Dagmar.
Does Dagmar want to respond to that first? Is that
Yeah,
first?
yeah. No, Dagmar, go on. You had something in your mind.
Yeah, no, I wanted to be really practical and was wondering whether as community subgroup we could finish off to pledge that we each of us try to recruit one more community champion. How about that?
Yeah.
Just an idea.
One or two. And merit,
no upper limit, at least one.
Merit marks for 2. Ellie.
I've already been advertising it in my newsletters to residents and so on, you'll be pleased to know. And I was just thinking about, other groups that I need to make sure are signed up. What was my point? My point was going to be, it's back to the comms piece. I'm so worried about sharing anything that isn't kind of official Merton comms or official government comms, because I don't want to, accidentally spread anything that's wrong. So that's almost a bit of a challenge to that idea of democratizing it and making it more community-based. So that's a kind of general point. I suppose my question to Barry is, well, can you make clear when something's really important and you really need us to get it out? We've got a lot coming at us that we're being asked to share with our residents and so on in our communities. So if it can be like this is crucial, you need to really help push this message out.
Yeah. Sorry.
Una, did you want to come in?
I mean, just briefly, I think Ellie actually has covered it and pretty much. So I mean, I'm full square there. I think we have to be quite careful in what we're putting. Well, I try to be anyway, and I think most of my group are, in terms of what we're putting out, COVID related, because it does need. Well, I prefer to be putting out either Merton or government advice.
Yeah.
I think That's how I tackle it. But I would like to just thank Barry really for promoting and really taking on you know, the COVID champion. I'll certainly try and recruit more, Dagmar. And I think the workshop's really good. I you know, joined one, and I just felt it was, you know, really useful, very helpful to people, and a great way for people to interact and make sure that they're getting the right messaging, and a venue for them to put their queries and get those sort of things answered, because I think that's really important, because some of the messaging, you know, is really hard for people, and you know, some of it feels as if it's conflicting, even if it isn't, not least where you've got, you know, can you have a funeral, can you have a wedding, and all the different, you know, what about other life? You know, I've had a lot of questions about baptisms, for instance, and so on. And, you know, it's actually, it is very hard to get one's head around it. You know, there's a rule of 6, but what happens, you know, but you're allowed something else. And, oh, no, you're not, you know, can I be in the garden? Should I be here? And
Yeah.
it is, you know, it has changed. It is tough. And I just hope, I'm sure that Stephen will be on the London call and so on, that whatever new regs we have, really have to be clear, and I think that's the important thing, that whatever London regs we get are clear and clearly communicated, so that people get it and can't have, and some people try and have an excuse not to get it, I'm sure, but you know, but I think we really need the majority to be able to get whatever new stuff comes. Thank you.
Thank you. Yes, there is now a weekly briefing of all leaders of councils from all parties, all 32 plus the City of London, and chief executives as well. So the meeting earlier this week was with roughly 60 people plus, and that's every leader in London. I've got Mo, and then I'll go to Mark, and then Clarissa. Mohan.
Okay, yeah, thanks, Stephen. Yeah, I just wanted to say, I don't know if you see my T-shirt, it says "Don't medicalise, personalise." So that's the new T-shirt out at the moment, and that's about personalising care to what matters to you. And that's one of my other roles I do for the Royal College. And actually that relates also to communities, and actually what Rob was saying, actually you need to listen to your audience, listen to what they're saying to you, and actually have that compassionate leadership to actually then change to what the needs of the community is. And I think going back to, again, another point what Abby said about the faith groups, and that's a group I think we haven't really got good representation for, and I think the health champion's brilliant, but I sometimes think we get the same people turning up, and it'd be nice, maybe we might need to target a faith group and go, right, you're not leaving until we get one of you, but we might need to actually go and actually really try and get those hard to reach groups who haven't done previously, but yeah, don't medicalise, personalise.
Thank you. Mark, and then Clarissa.
I'm going to just hand over to Kaz, because I think he's wanted to jump in. So
Yes.
Okay, Kaz.
You're on mute, Kaz.
Hi, Councillor. Hi, everyone. Yes. So loads of great points, and I've been wanting to jump in. And I think there's really resonating with the view that we need to be able to rethink how we're delivering services in order to reach the folks who we need to, who are suffering the most burden of disease. And that's something that we're thinking about. I think that the primary care network project is a good way to, at its heart, network the assets that we have in communities with primary care networks, and to deliver together projects that will move the needle in the right direction with regards to health inequalities. But the most important, I think, outcome will be the gaining of skills, knowledge for partnership between primary care networks and other folks in communities, so that it's a collective response. I would also say that, you know, in terms of being able to deliver in community settings, but also upskilling people in the community to deliver those services. Again, that's a place where I think we're making a start, and I'm working with colleagues to think about how things like, for example, a flu, you know, if we did a flu clinic, could that be something that is done in partnership with local people? If we're looking at long-term conditions, can those interventions, are there aspects of that can be taken, where ownership can be taken by people who are again at the worst burden of that particular disease. Finally, I would just like to say that there is something about our view of communities. So I think that ultimately our culture collectively is what is producing some of the disparities. So we have too much salt, too much sugar collectively in our diets. It's not necessarily anything that's particular to the diets of any one community. It is just that the same patterns of consumption contribute to that burden of disease, along with other social, issues. So thinking of biological weathering, for example, what are the experiences of particular communities that contribute to that greater disease burden? What are the determinants of health, like housing? So we should keep those in mind, because we may risk othering and the saying that there are particular things that it is the community's responsibility, when it's in terms of choice architecture, in terms of what the things that are outside of direct control that contribute to these things. And it's something that we should focus on as we're considering how we communicate, how we work in partnership with communities. Okay, thank you very much for that, guys.
Oh, and thank you, Kaz, and apologies that I didn't spot you earlier. That's my fault. I didn't look at that little participant thing. I should have looked at more regularly. But thank you, Kaz, for that contribution. I think we're there with our meeting today. I hope that Dagmar, we fulfilled our brief, what we're about as a subcommittee, and that we're doing our best to safeguard the residents of Merton and London-wide. I wanted to thank Clarissa, Amy, Matt as well, Kaz, and all of you for being here today. And I can now declare that our subgroup meeting for tonight is closing. Thank you all very much, and see you next time. Bye-bye.